Care, Gillian Keegan. Good morning to you.
Morning.
Thanks for joining us. So can you let us know what's happening with this when it comes to restrictions, that whether they are going to be put in place, when they are going to be put in place? What does New Year look like for people?
Well, as the Prime Minister said, we've obviously said we'll be OK till Christmas, but we look at that data all the time. There's still uncertainty in the data and there's still some things moving around. Obviously, the boosters is the great thing, so that's very positive. Nearly 30 million people have come forward for their booster. Thank you to everyone. All those that haven't, please come forward. Even if you haven't done your first or second jab, it is never too late. And that really helps with the wall of defence. But we still don't have, for example, the data on the severity, etc. So we're still waiting. There's a lot of uncertainty still in the data. We are getting it every day, a couple of times a day. We're meeting all over Christmas and we'll be looking at that data very carefully. And we're trying to take a balanced approach. We don't want to just, anticipate what it's going to be. We're trying to... There's a lot of things moving around. You mentioned the antivirals as well. They're coming in January. All these things help. The use of testing as a tool, all these things help. But we will not hesitate to put things in place if the data shows us we need to.
OK. Isn't there an issue, though, that by the time potentially we get that data, it will be too late? Because, the phrase that we've all heard is that it's baked in by then, isn't it? That those numbers will have got to a stage where so many people will have been infected and then there will be inevitable hospitalisations. But if action isn't taken, if we don't anticipate this before we get confirmation of it, then it's going to get out of control.
Well, that's where we need to get the balance, and we need to balance the risks. Obviously, if you've got something that's highly infectious, and we know the infections are doubling every couple of days, if you just took that input, then obviously you would basically say, OK, we're going to make this analysis. But of course, things are different. The vaccines, the efficacy of the vaccines, the booster jab, how quickly we can get those boosters into people's arms. We don't know the severity rates of the disease yet. We're obviously looking at the hospitalisations and tragically the death numbers. We look at those very carefully. So it's difficult when you have uncertainty, and it is difficult to make. I mean, we've been dealing with this all along. You don't have perfect data to make a decision. But what we're trying to do is get a balanced and proportionate approach.
It's also important to say, isn't it, that some people are sort of sceptical about the need for restrictions. Look at the numbers. The death numbers are tragic. They haven't gone up significantly yet. However, it is so transmissible. We look around us, even at this very television show, there are people not at work in massive numbers. And an issue perhaps that we need to focus on a bit more is, without some sort of restrictions, the hospital staff are going down left, right and centre. So that's part of the potential car crash, isn't it?
Well, that's another thing we have to manage. I mean, there's nothing easy about what we have to manage. I think you can definitely say that is true. But that is why we've also introduced the changes overnight. We've looked at serial testing, using testing more during that isolation period to bring it forward. So if you get a negative lateral flow test on day 6 and day 7, and they're negative on both days, then we're saying, be cautious, but you can then leave isolation earlier instead of just waiting the 10 days. So we're using testing a lot more this time round to try and, again, contacts of people to use testing to make sure that you can still go out and about. So, and we do have lots more tests. We're one of the biggest procurers of tests in the world, and we've done more tests than most countries.
Can I just check something with you on testing? Because I know you've been talking about lateral flow tests and their accuracy earlier on in other interviews today. 80 to 90% accurate, you said they were. But we understand the New Scientist, for example, they are quoting that they are 40 to 60% with their sensitivity. So there's quite a difference here. So is it really the right way to rely on this? How much can we rely on them? And you've got this 80 to 90% figure. Is that right?
It's when you're highly infectious. That's actually the figure they've looked at. When you're highly infectious, how likely is it that it picks up when you're highly infectious? And that's the figures that we have. But we've got to use the tools that we have, and we've got to again take that balanced risk. There is no risk-free approach. We have definitely discovered that, but it's about getting a balanced risk. And lateral flow tests, we have done so many of them now that they are a useful tool. They are enabling us to manage things, but they are not as useful as the vaccine. So please, everybody, if you haven't, please come forward for your vaccine or your booster.
I've been doing them every day, lateral flow, and yesterday I was properly reading the instructions, and it's very clear about how long you leave it in your mouth, how many times you turn the swab around, how long you leave it in the solution for, and I wondered how many of us aren't actually doing them properly either, so that you get the wrong result.
Well, hopefully they are. I mean, I think I was taught 10 times down each side of the mouth, 10 times around your nose, each nostril, and then put it into the liquid. I think it was at least 15, but I always leave it for a bit longer. And then obviously you look at the results. I don't know. I mean, I was taught during my first one what to do in Parliament, actually, where I had my first one. But people should read the instructions. It is important to read the instructions. I would imagine, I mean, that's why when we introduced them in schools and colleges, their first tests were actually done in the schools and colleges so that people could be shown how to do them properly.
OK, we're just running out of time. I want to ask you about the situation in care homes, because we know restrictions have been put in place with people that can go and visit their loved ones, haven't they? Have you got the balance right on this one? Because obviously, you know, there were residents who last year had Christmas alone. It was a really tough time for them mentally, wasn't it? But we have to protect people in care homes. We know all too well how vulnerable they are.
Yeah, it's a really difficult decision. I think we've got the balance right. So what we introduced during the year was that everybody would have an essential caregiver, and that essential caregiver can go in, you know, unrestricted pretty much. But in addition to that, we have now restricted to, say, 3 other named friends or family members. And it is about trying to keep people, you know, able to see their loved ones over Christmas, but also to try and protect those that we know are the most vulnerable in our society. And of course, we're getting everybody boosted in the care homes as well, and those at home as well will be getting boosted. We'll be coming to you shortly if you haven't yet received your booster.
OK, Gillian Keegan, Minister of State for Care, thank you very much indeed.